Erectile issues are more common than most guys realize. Even healthy men, about 1 in 10, deal with it at some point. And the numbers jump way higher for men living with health problems like diabetes or heart disease. You might notice it showing up in small ways first. Your legs feel heavier, your hips get stiff, maybe your belly and lower back feel tight, or even a little numb. But here's the good news. There's a powerful technique you can use every single day that takes just 5 minutes. And the only tools you need are your own 2 hands. In this video, I'll walk you step by step through a simple science-backed self-massage routine that improves circulation, eases tension, and helps you reconnect with your body. For a lot of men, noticeable results show up within days, not months. And stick around, because I'll also reveal one small thing you can do tonight that could completely change the way you wake up tomorrow morning. So what exactly is male wellness massage? And why does it work when so many other methods don't? Here's the truth. This isn't about pleasure in the way you might be thinking. It's about waking up blood flow, calming tension in the pelvic floor, and reactivating nerve pathways that have been asleep for years. It's not about becoming a brand new person. It's about reconnecting with 4 core elements of male vitality: your mind, your breathing, your heart, and your pelvis. That pelvic region, your penis, the perineum, and the lower abdomen, is packed with a dense network of nerves. The key player here is the pudendal nerve. Think of it as the main highway carrying signals and sensations throughout the area. But just like any road, if it's blocked, neglected, or underused, thanks to stress, tension, or age, the signals slow down. That doesn't mean the nerve is broken. It just needs the right kind of stimulation to wake back up. And research backs this up. In one clinical trial, men who practiced pelvic floor exercises saw significant improvement in erectile function compared to those who only made lifestyle changes. After 3 months, their scores on the International Erectile Function Index jumped by nearly 7 points, and 40% of them returned to normal function. That's the science behind the massage methods you're about to learn. They work with your body's natural systems, not against them. You don't have to be perfect. You just have to stay consistent and give your body the chance to remember what it's capable of. Technique 1. The ring glide. Let's start with the first technique, known as the ring glide. The setup is simple. Take your thumb and index finger and form a gentle circle at the base of your penis. The key word here is gentle. You don't want to squeeze or create pressure. Think of it as guiding your hand, not forcing it. Before you begin, apply a small amount of natural oil. Coconut oil and almond oil work really well because they keep the motion smooth and reduce any friction. A light layer is enough. You don't need much. Once you're ready, start at the base and slowly glide upward. When you reach the top, release. Bring your hand back down and repeat the motion. Keep the pace steady and unhurried. As you do this, connect the movement with your breathing. Inhale slowly through your nose as you glide upward. Hold the breath briefly at the top. Then exhale through your mouth as you release and return to the starting position. This rhythm of breath and touch calms your nervous system, lowers stress, and supports healthy blood flow. Now here's why this matters. Over time, many men experience reduced circulation and sensitivity in this area, often without realizing it. Stress, sitting for long hours, or simply aging can all play a role. The ring glide encourages blood vessels to open and improves oxygen delivery to the tissue. This helps reawaken nerve endings that may have been less responsive for years. At first, you may not feel much change, and that's normal. For some men, the first signs show up as a subtle warmth or light tingling in the pelvic region. Others notice that they simply feel more relaxed. These are early signals that circulation and nerve activity are starting to improve. The other important part of this technique is awareness. Don't treat it as just another task. Set aside distractions. Turn off the TV, silence your phone, and give yourself these few minutes without interruption. The more present you are, the more effective this becomes. Some men even find it helpful to close their eyes and focus entirely on the sensations and their breathing. You don't need to spend a long time here. Just 3 to 5 minutes is enough to begin creating real changes. The key is consistency. Practicing this nightly or at least several times a week helps train your body to respond and rebuild healthy patterns. Men who use this technique regularly often notice meaningful improvements within the first week. For example, better morning erections, a greater sense of sensitivity, or simply feeling more comfortable and connected in their own body. Technique 2. The perineal pulse. The second method is called the perineal pulse. This technique focuses on a part of the body that most men rarely pay attention to, but it's one of the most important areas for overall male wellness: the perineum. The perineum is the soft stretch of tissue located between the scrotum and the anus. Even though it's not often talked about, it plays a major role in circulation, sexual health, and pelvic stability. It's positioned right below the prostate and the pelvic floor muscles, which means it has a direct influence on both function and comfort in that region. To practice this technique, start by finding a quiet, private space where you can focus. Wash your hands, then use two fingers, usually your index and middle finger, and place them gently on the perineal area. You don't need strong pressure. Instead, apply light circular motions or gentle pulses, just enough to create awareness and stimulate the nerves. As you work with this area, keep your breathing slow and steady. Inhale deeply through your nose, hold for a brief moment, and then exhale smoothly through your mouth. Try to match the rhythm of your breath with the motion of your fingers. This combination helps calm the nervous system and encourages relaxation of the pelvic floor muscles. Now, let's talk about what's happening in your body while you do this. The perineum is rich with nerve endings that connect to the pudendal nerve, the same nerve we talked about earlier that controls sensation and function in this region. By stimulating the perineum, you're improving nerve activity, reducing built-up muscle tension, and promoting better blood flow around the prostate and pelvic floor. Over time, many men notice several benefits. Some experience deeper, more restful sleep. Others report improved urinary flow and fewer interruptions at night. And of course, many also notice better sexual response and sensitivity. These improvements happen because you're addressing the underlying systems that support overall male vitality, not just the surface symptoms. This exercise only needs a few minutes of consistent practice, 2 to 3 times a week, to begin making a difference. The perineal pulse is simple, but it's one of the most effective ways to restore balance, comfort, and natural function to the pelvic region. Technique 3. The breath stroke. The third method is called the breath stroke. This technique combines gentle touch with mindful breathing, creating a strong connection between the body and the nervous system. To begin, place one hand flat against your lower abdomen, just above the pelvis. Sit or lie down in a comfortable position where your body feels relaxed. Once you're settled, take a slow breath in through your nose. As you inhale, gently glide your hand upward, following the movement of your breath. When you exhale through your mouth, slowly move your hand downward to its starting position. The goal is to keep your hand movement and your breathing perfectly in sync. You're not rushing the motion, and you're not forcing the breath. Instead, think of it as training your body to move and breathe in one steady rhythm. So why does this matter? Most men carry tension in their lower abdomen and pelvic area without realizing it. Stress, long hours of sitting, and even emotional pressure can all cause the muscles here to tighten. Over time, this tension interferes with blood flow and weakens the natural signals between the brain and body. The breath stroke works to release that tension and restore communication. When practiced consistently, this technique lowers stress hormones like cortisol and increases nitric oxide production. Nitric oxide is essential for blood vessel health and plays a direct role in achieving strong natural erections. On top of that, the slow, controlled breathing helps retrain your nervous system to respond with calmness instead of anxiety, which is a common hidden factor behind performance struggles. What many men notice after just a few sessions is a deeper sense of relaxation. Some describe feeling lighter in their body, while others report improved focus and steadiness in their daily routine. Over time, it also strengthens the connection between your breath, your attention, and your physical response, something that can easily get lost through years of stress and disconnection. You only need about 3 to 5 minutes of practice to start feeling benefits. The breath stroke is simple, but it's powerful because it brings together two key systems, your breathing and your circulation, into one unified practice. These 3 methods may sound simple, but that's their power. They target the essentials of male health: blood flow, muscle relaxation, nerve activity, and mental connection. So the big question: how fast do results actually show up? For most men who stay consistent, change happens in days, not months. Day 1-2, you may notice subtle warmth, tingling, or just a new awareness in your body. Day 3-4, circulation picks up. You may sleep better, wake up fresher, or feel more centered during the day. Day 5-6, erections often become stronger or more spontaneous, especially in the mornings. Sensation and sensitivity start returning. Day 7. For many men, this is the turning point where real lasting erections return and confidence follows. One guy even told me he caught himself humming at breakfast, realizing he hadn't done that naturally in years. That's how deep these shifts can go. Now let's talk about tonight. Here's a 5-minute habit you can start before bed. Find a quiet, private spot. No distractions, no interruptions. Sit or lie down comfortably. Place one hand on your chest, the other on your belly. Take 3 slow breaths. Inhale through your nose for 4 counts. Hold for 4. Exhale through your mouth for 6. Tell yourself something encouraging, out loud or in your mind. I'm still here. I deserve care. I matter. Then, with clean hands and a little natural oil, practice the glide, the pulse, and the breath stroke. When you finish, don't just rush off. Sit quietly, breathe deeply, and recognize what you just gave yourself. For a lot of men, this short nightly practice becomes the most meaningful part of their day, not because of instant results, but because it reminds them they're not broken. They're healing. These massage techniques have already helped thousands of men rebuild confidence, restore function, and reconnect with their bodies. Now I want to hear from you. Drop a comment below. What's your biggest challenge with energy, vitality, or intimacy as you've gotten older? Physical, emotional, relationship-based? I personally read every comment and respond to as many as I can. And if you found value in this, hit like, subscribe, and stay tuned. I'll be sharing more advanced methods, answering your questions, and diving into the latest research on male wellness. Thanks for watching, for showing up for yourself, and for taking that first step back toward your best self.